Evening, ma'am. It is
Good
truly
evening.
privilege. It is truly privilege and moment of great pride for us to welcome a personality like you who has significantly redefined public health awareness in India. Before we begin, I would like to briefly introduce our platform QuizCura to you. QuizCura is a national medical engagement platform that connects over 200 medical colleges across India through campus coordinated network. Through this, we deliver structured academic initiatives such as weekly test series and national level quizzes to promote consistent learning and engagement among medical students. Along this, CuraVerse is a student-driven magazine that aims to keep medical students across country informed about medical affairs and about various PG platforms, and most importantly, inspire them to become better clinicians. From our entire team, I extend you a very warm welcome. For all our
Thank
viewers
you.
watching,
And all the
for
best.
Thank you, ma'am. For all our viewers watching this interview, it is a matter of great pride to have our esteemed guest, Dr. Sivaranjani Santosh, ma'am. Thank you.
Thank you.
So, ma'am, for our viewers, I would like to just briefly introduce you. So, our esteemed guest today is none other than Dr. Sivaranjani Santosh, ma'am herself, the widely acclaimed ORS Lady of India. Ma'am is not just a pediatrician, but a first aid trainer, a social activist, and she has vouched for multiple ethical things and rational medical practices throughout her career. And she has impacted thousands of lives throughout the country. Ma'am, we are really grateful and thankful that you have devoted a great deal of time from your busy schedule to us. And we are really thankful, and we welcome you by all our hearts. And ma'am, how are you feeling today, ma'am?
Good. Nice. Very nice.
Yeah. So, ma'am, let us briefly introduce ourselves also. Ma'am, my name is Dhruv Saxena, and I'm a third year medical student from RDS MC Ayodhya, Uttar Pradesh. And
And ma'am, my name is Ujjwal Kumar Pandey. I am a fourth year MBBS student in Government Medical College, Nagarkarnool, Telangana, with a keen interest in public health and clinical practice. So, ma'am,
Very nice.
beginning the interview on a lighter note, I would like to ask you, you are widely regarded as the ORS Lady of India. How do you perceive this title and what is your opinion on it?
First, when I heard it, it was very amusing. But yeah, there are so many great people who have actually brought this ORS, the life saving solution, into existence. And I think they deserve to have such a title rather than me. But
that is
it
so
feels
humble.
nice though. It feels nice though. Yeah.
Yes, ma'am. It is a good feeling attached to it, I guess. That's very humble of you. So, ma'am, my next question to you is from my side. So, ma'am, we know that your efforts against the false marketed ORS, false solution, ORS solution that have been circulating in the market has been since 2017, and only recently on 14th and 15th of October, you have got a verdict in your favor, in our favor, actually. So, ma'am, I want to ask you that how did you keep yourself motivated and persistent throughout this whole journey? Like you yourself have called your journey to be a dog persistence. So, ma'am, how do you say that you kept yourself motivated, and what were your driving factors, ma'am? If you could put
The
some.
only one driving factor that every child who is receiving the misbranded liquid instead of ORS is likely to die
Yes.
because of dehydration. So that is the one and only motivating factor which kept me going in spite of the journey being very tumultuous. So there
Yes,
is
ma'am.
no other motivating factor in spite of the stress, in spite of the trolling, in spite of the threats, in spite of the indifference from the authorities and professional bodies.
Yes.
Everything, the only thing is that, oh no, another child can die.
Yes, ma'am.
And I can't let that happen. And knowing that I can stop it, like, how can I just give it up midway?
Yes, ma'am.
That was very insightful and inspiring, madam. Ma'am, your struggle with these pharmaceutical companies has a very long history. And as my friend who mentioned, you term is as a dogged persistence. Regarding that, you received a letter on 16th March from these pharmaceutical companies. And what is your opinion that how far these pharmaceutical companies can go to suppress the voice of those who are working in favor of public good?
You yourself have seen from the notice that they have sent that they are
Yes, ma'am.
willing to go to any extent to do business, even if it is at the cost of health and lives of children. And they will go to any extent to arm twist the. These are all arm twisting tactics. And I think now it's very clear that they'll go to any extent to silence somebody who is speaking for public health if it is going against their business.
Yes, ma'am. It's clearly visible, and ma'am, we are really thankful that you are still fighting for the good cause. Uh, Ma'am, my next question to you is somewhat of a personal doubt. Ma'am, in your reels and videos, you have advised to parents and patients that if the proper ORS solution is not available, they can use kanji or coconut water or rice water or lentil soup, some home remedies. Ma'am, what we see today as medical students and clinicians, and we see that when we counsel the patients for some dietary or lifestyle changes, they tend to develop a lack of trust in the clinician. Like they have developed a perception that if they are not getting a medicine, something, they're not being treated. Ma'am, how do you think that we as medical students or upcoming clinicians should deal with this challenge or should tackle this thing? What's your overall opinion on that?
First thing in my videos, I always said if you don't have WHO formula ORS, how they can prepare it at home. So I always
Yes, ma'am.
said that the recommended formula, the sachet, is any day more accurate than the homemade one. But you can
Yes,
prepare
ma'am.
it at home by adding a pinch of salt and a teaspoon, 5 ml spoon of sugar to 200 ml water, or half teaspoon of salt and 6 teaspoons of sugar to 1 liter of water. In addition to that, you can take buttermilk, water, and ganji. This is what we said. Okay, I said.
Yes, ma'am.
And as far as your question is concerned, initially there will be resistance, but the
Yes,
more you
ma'am.
educate them, the more patient you are with them, they would understand. The more you educate that you take medicine when needed only,
Yes,
only
ma'am.
when it is appropriate to take medicine. Okay. Otherwise, you don't take the medicine or give it to your child. So that education,
Aware.
um,
Yes, ma'am.
if you educate your patients or the parents of your patients very patiently, it works actually. That I'm a standing example of that. So many
Yes,
of
ma'am.
the parents who bring their get their kids to me, they don't give unnecessary medicines at all, and for them, I'm not a bad doctor at all. In fact, I'm not able to uh, manage the my OPD anymore. It's
Yes, ma'am.
crazy. Like we are
Mhm.
having 1.5, 2 months backlog for patients right
Oh
now,
my God.
for
Yes,
the
ma'am.
kids. So it's not like that. It's people, when the honesty is there, when your integrity shows up, when your
Mm.
eagerness and earnestness to educate them, is
Mm.
obvious. I
Mm.
think you will be a winner only.
Okay.
That was very insightful and very well elaborated, madam. Ma'am, since you yourself
Because
a
if what
pediatrician,
you say, if you what you said is right, my OPD should be empty, and it's
Mm,
not so.
I'll think upon that, ma'am.
Yeah.
ma'am, you yourself being a pediatrician, you are widely regarded as very empathetic. So, ma'am, what do you think that what is the role of empathy in a clinician, and how can we become a more empathetic future clinician and doctors in future for all the
Yeah,
aspiring
we have
doctors?
seen Munna by MBBS, right? Mr. Boman
Yes, ma'am.
Irani says you can't
Yes,
be
ma'am.
empathetic, but that's not
Mm.
right. Like, empathy has to be a part of medical care. Okay, I'll tell you
Yes,
my
ma'am.
own example. When I was a first year resident, I was putting an IV line for a baby with
Hmm.
meningitis to give, not meningitis, pneumonia, I think, to give
Okay.
IV antibiotics, and the mother was crying. And I was
Hmm.
telling my senior, why is she crying? It's only like for her baby's good only. Now I'm putting the IV line. Okay.
Hmm.
Then the senior said, when you become a mother, you'll understand.
Hmm.
Okay.
Hmm.
Okay.
So and
Yes.
I truly, when I did become a mother, the whole perspective changed. I mean,
Yes,
like
ma'am.
everything, like if my mother says I'm not able to latch my baby, it's painful. Immediately I
Hmm.
get into her shoes, I understand where she is coming from and help her.
Yes, ma'am.
And the outcome any day is much, much, much better. It's
Hmm.
not like you are, and the parent also understands that yes, doctor has understood my pain, so it's
Yes,
not
ma'am.
some like robots we are treating. It's not machines that we are working with. It's real human beings that we are working with.
Yes, ma'am.
So empathy is very, very crucial here. Very
Hmm.
crucial here.
Hmm.
So, I mean, there is no way we can say, like, empathy
Hmm.
doesn't have a role in medicine. Empathy has a major role to play in medicine. So, even this ORS thing, just imagine, like,
Hmm.
that pain you feel, like, a mother going to the pharmacy, asking for ORS to make her
Hmm.
child well, and the child
Right.
ends up in hospital because of the misbranded sugary liquid given to
Disastrous,
her.
ma'am.
It's so painful. You
Yes,
feel
ma'am.
Yes,
that
ma'am.
empathy, you feel that pain. That's why you fight. Okay, so
Yes, ma'am.
empathy will make us better doctors
Yes, ma'am.
and better
That's
human beings.
yes, ma'am. More better that way. Yes, and that's truly correct. And I guess we all will take that further in our lives also to make note of that. And then my next question to you is that it wouldn't be a big thing to say that you got enormous support through Instagram and social media. Like everyone here, everyone nowadays I see is saying that ban these products, Kenvue and Johnson& Johnson. Ma'am, my question to you is that how do you see Instagram and social media yourself? And as from a student's perspective also, like, is it a distraction? Could it be a tool? Could it be something else? Like, what's your
It's
overall opinion?
it's a two-edged sword. I mean, see, you use it right, you
Hmm.
bring a good change. You use it the
Hmm.
wrong way, obviously, you're going to mess up things for people. So, for me, it was always to raise awareness and to dispel myths. That's how it started, and I've kept it clean that way. If you see, you don't see my clinic address, any details about my clinic, where I
Hmm.
practice from. Many a times, people end up in my clinic. Oh,
Hmm.
oh, you are the
Oh,
same
you are that.
doctor.
Yes,
ORS
ma'am.
lady.
Yes.
Hmm.
Okay, for them, that Sivaranjani is different. This Sivaranjani,
Hmm.
because somebody referred, they come to my clinic,
Right.
word
Right.
of mouth. But then they
Right.
realize it's the same person. And similarly,
Right.
if you see, I don't endorse any brand or anything, even if it's the best brand, because I don't want to
Right.
create bias. I'm not there
Hmm.
to earn money. I'm only there to spread awareness because it gives me a kind of sukoon,
Hmm.
a kind
Hmm.
of uh,
Peace in the heart.
peace of
Hmm.
mind. Okay, that's why I
Satisfaction.
am there. So, as I said, like, if you spread wrong information through it, obviously it's bad. So,
Right.
used correctly, it's a very good tool. In fact, if I haven't been on social media, if
Hmm.
Good Samaritans hadn't told me about the FSSAI order of October 14th, 15th, though
Hmm.
they cannot directly tell me, some
Right.
people, they want to do good, but they can't openly inform. And
Right.
if you
Right.
didn't
Yes,
see
ma'am.
my reaction that day, The message
Hmm.
wouldn't have spread like a tsunami the way it did.
Yes,
If
ma'am.
if that didn't happen,
Hmm.
maybe Kenview would have gotten a proper stay order, and maybe
Yes, ma'am.
things would have been the same. So
Yes,
social
ma'am.
media pressure did play a tremendous role in this.
Hmm.
Yeah, so we should use it the right way,
Yes, ma'am.
That
without
was
any without any ill I mean without any malice
Hmm.
in our heart. I mean,
Hmm.
so yeah, you can use it the right way for the greater good.
I think it was a game changer in your story, ma'am, I guess.
Yes, yes,
indeed, it was very game changing, and social media, I think, was the tool that helped spread awareness in a very accelerated fashion. Ma'am,
yes.
continuing on that note, we see that today there is widespread usage of antibiotics. People are becoming doctors themselves, and you are using it frequently without any prescription from a proper doctor. Ma'am, what do you have been also been working regarding the awareness program regarding the antibiotic development of antibiotic resistance and their uses? What do you think are the hindrances or the obstacles that are coming in awareness in the spread of this awareness program?
The first problem is us doctors only.
Okay.
Hmm.
Okay, so we randomly prescribe without following protocols. Okay, in some
Hmm.
remote areas, it's difficult to get all the investigations done, but still, at least your clinical judgment, you have to base it on
Hmm.
your clinical judgment. And you
Yes,
have to know, like, which are the antibiotics you can use first, which are, you have to use only when necessary. Watch, like, you know
ma'am.
the WHO guidelines, right? Okay,
Hmm.
so aware classification, accessible, watch, and reserve. So you can actually incorporate that into your practice. Okay, so evidence based, and if you're not able to get evidence, and there is no time for you to wait for evidence, then at least based on your clinical acumen, use it only when you feel it's necessary, and the
Hmm.
narrowest spectrum one. Okay, we are not doing that first thing. And if you
Yes,
see
ma'am.
many prescriptions, I mean, you'll see two, three antibiotics, especially in the tier two towns, tier three, all these places and villages. Urban areas, it's changing a little bit, to be very frank. It's improving the situation. Second thing,
Yes,
all
ma'am.
these are available over the counter. So we doctors only have created a feeling among people that antibiotics are the solution for everything, and now they are
Hmm.
available over the counter. So now here the patient himself or the parent herself is a doctor, the pharmacist is a doctor,
Yes,
and the
ma'am.
person standing in the pharmacy, because every pharmacist won't have pharmacists, they are themselves doctors, and the authorities are not regulating it, they are not making it strict that antibiotics are to be given only with prescription. And
Hmm.
our people get knowledge from their friends, and they take their
Hmm.
advice and give antibiotics. So first thing, I think government should first stop allowing the sale, over the counter sale. That is
Hmm.
the most
Totally.
crucial step. And as
Yes, ma'am.
doctors, we have to follow the protocols as much as possible, unless it's a life threatening emergency,
Hmm.
and we have to start the antibiotic within the golden hour.
Hmm.
So, and the pharmacists and the persons working in the pharmacies have to give the prescribed antibiotic only. They should not give
Hmm.
without prescription. And people have to complete the courses of antibiotics. So there are so many angles to this, but first I think it should come from the government and from us
Hmm.
doctors.
Yes,
Hmm.
ma'am.
I guess this issue really needs continuous attention and thought, and I really think that removing them from the OTC category would be a way to do it.
Yes.
Ma'am, now my next question to you is, you have
No, no, they
continuously
are not in the OTC category. They are not in the OTC category, but they're being given
Yes,
in the
ma'am.
OTC
Yeah.
category.
Yes, ma'am.
Laws are there. They are
Yes,
not
ma'am.
implemented.
the particular implementation is lacking, I guess.
Yes,
So, ma'am,
exactly.
Ma'am, my next question to you is that you have continuously vouched for that BLS teaching should be done at school level. And ma'am, my question to you is, do parents also need to learn BLS? And not just parents, like common people also. What essential medical skills or knowledge should we
Oh,
as common people should have?
you know me only from the ORS thing. But
Yes,
I started training parents and common people from 2010 in CPR and first aid for choking and seizures and first aid for other common emergencies. I've
Yes,
by
ma'am.
now trained more than 25,000 people alone, in addition to my
Hmm.
social media posts, alone and
Yes,
with
ma'am.
some support from my other colleagues. Obviously, like when you are organizing a session for 100 on 50 people, you need support from
Hmm.
our other colleagues. And now I have even motivated some doctors from other states to start the
Hmm.
program, and I've sent mannequins to them, and they have
Hmm.
started doing it in their states for schools. So in Hyderabad, I've
Very nice,
done it
ma'am.
for many, many schools. So this movement will go on. And in Telangana,
Hmm.
I have managed to make the parents donate mannequins for students um, of around 19 medical colleges in Telangana. And these all are part of a foundation called Goodwill Foundation. And these
Okay.
students are going to take it forward in their respective districts. So they are reaching out to the collectors in the respective districts, and they are going to start the school programs for first aid for choking, seizures, and calls. Not exactly CPR, only compression
Hmm.
only, life
Okay.
saving, that they are going to
Hmm.
start. So yeah, this is the first one I started working on from
Yes, ma'am.
2010.
Yes, ma'am.
So this is something very close to my heart, and I myself was choked from dying due to. I mean, I myself was saved from dying due to choking by my house surgeon when I was
so
working as a junior resident in JIPMA. So I
Hmm.
mean, maybe that acted subconsciously, whatever. But it is more of the
Hmm.
empathy factor again, like when a
Yes,
parent is
ma'am.
in such a situation, she should be able to save her child. And I
Hmm.
trained some police people, I trained ASHA workers, I went to some villages and trained people there, some parents from urban slums. That is something which is an ongoing process. And on 8th April, my birthday, we are organizing a huge first aid program for parents, and grandparents and caretakers in English, Hindi, and Telugu.
Hmm. And that's really nice, ma'am.
So this will go on forever. But this is
Hmm.
not a fight. This is a mission first aid.
Yes.
Okay,
Yes, ma'am.
the ORS thing was like I had to deal with a lot of
Hmm.
indifference and people ridiculing me, people putting me down. Um, yeah, so that's a totally different thing.
Hmm.
ma'am, very well explained. And ma'am, I would like to inform you, my college is one of the beneficiaries of those of the Goodwill Foundation mannequin. We recently got that mannequin in Nagar
Okay,
Karnool.
that's very nice. That's very nice.
Ma'am, coming to my next question, you recently signed for organ donation with Mohan Foundation. That is very inspiring. Ma'am, however, you see there's still hesitance and reluctance among the normal people in India regarding organ donation. What do you really think is the reason for this resistance or reluctance? And ma'am, what is your personal opinion that is organ donation obligation or a personal choice? Like, what is your point of view on that?
That's a difficult question to answer. But for me, I see after my death,
Hmm.
I'm like basically I'm gone. But if my
Right.
organ is saving somebody, helping somebody to see, or saving somebody's life,
Yes,
So let
ma'am.
it be useful, no? Like you are
Yes,
when
Hmm.
you lived, you tried to be useful to the society, and after your death also, if you are being useful to the society, I mean, what more do you need? And your, I mean, like even your family would be so uh, so happy.
Yes, ma'am.
But for me, it took so long because I was hepatitis C positive
Yes,
when
ma'am.
I was a junior resident. I took
Hmm.
treatment from CMC Vellore at that point. I've
Hmm.
repeatedly checked my RNA levels later on. They were always negative, but I had this slight hesitancy whether they will accept me as an organ donor. So that
Hmm.
day when I met Lalita ma'am from the Mohan Foundation and I expressed my
Hmm.
apprehension, she said that's
Hmm.
not a problem at all because I've been RNA negative for years now. Okay,
Right.
so that's when I said, okay, I was so happy. Like immediately I said, ma'am, send the link. I want to be an
Hmm.
organ donor. Huh?
Hmm.
So the reluctance in the society, I think awareness is lacking, and there were some
Hmm.
movies where they actually showed it to be some kind of trade, organ trade, and all that. See,
yes, ma'am.
Hmm.
wrong things happen everywhere,
Right.
but
Yes, ma'am.
Hmm.
showing those wrong things and saying that organ what do you say, I'm not getting the right word, such a noble thing as organ donation is
Yes,
being
ma'am.
smeared
Yes,
because
ma'am.
of these few people who are doing organ trading.
Hmm.
So the public has to be made aware that it is not organ trading. Yes, there are some
Right.
corrupt people, criminals who may be doing that, but that's not the way how it is. There are so many
Hmm.
countries in the Western world where organ donation is at like almost like I mean a very high level there. In
Hmm.
India, it's still,
It still
we
needs
are
a
still in the, I mean, we're still in the
Primary,
starting stage, I think.
developing stage.
So,
primary stage.
yeah, for the greater good, I think we can actually, you medical students, you can
Hmm.
pledge and you can make it,
Hmm.
on social media, you can actually bring more
Hmm.
awareness. So we are
Hmm.
together in this kind of thing. If we can start, it
Hmm.
will be great actually. Maybe we all should think about it.
I guess you're perfectly right. Awareness is the way to do it, and I guess some creative initiative are needed from our side also.
And
Ma'am,
dispelling fear that it is some kind of organ trade and people will kill you
yes, ma'am.
purposefully to take your organs kind of
Yes,
thing was
ma'am.
built around it because of one or two movies.
Yes, ma'am.
So that's one more thing we have to fight.
Yes, ma'am. That was really insightful. Ma'am, my next question to you is a bit of a common thing that all we medical students face, I guess. Ma'am, we as medical students, I guess, face a lot of issues like academic pressure, exhaustion, toxicity. Sometimes we are overworked or underpaid. Ma'am, I want to ask you, since your story represents such a motivational thing and clarity of thought, ma'am, what do you think there should be a message for all the medical students throughout the country, across the country, from your side, that who are going through a rough patch?
Here's where empathy comes again, because we all also have been
Yes,
medical
ma'am.
students, right? But luckily,
Yes,
I
ma'am.
was in a system where it was not so toxic. Okay, but
Yes, ma'am.
stay there. Okay, your
Hmm.
parents, you are precious for your parents. You're precious
Yes,
for
ma'am.
your family. Just hang on. And if
Hmm.
you are being harassed by anybody, reach out to any of us. Pharma has a helpline. So reach out to any of us and say, okay, we are being harassed. We'll try our best to address the issue. And if at any point you're feeling very low, don't take any drastic steps at that point. Please reach out to us, talk to us. We are there to help you. I know it's
Mm,
tough. I know it's very tough. Working conditions have to improve. And I think the residents, Pharma is trying its best to work towards that. So
mm.
just hang on and reach out to
Yes,
us
ma'am.
as needed.
Yes, ma'am. I
Ma'am,
guess the only way through is forward.
that was very insightful, and you told in a very elaborative way about the steps one can take to tackle this situation, which is widely unaddressed still in our society. Depression is still considered as a taboo. Ma'am, your words were were of great importance and value to us. I hope that in future we'll inculcate the habits and the work you put on, and will surely move forward to become a better clinician. Really thankful for your time. Thank you, madam.
I'm
Thank you.
truly
Nice
the
speaking to you.
Yes, ma'am. Truly the session was really inspiring, and I'm pretty sure that all our viewers must have earned something good from this session. And ma'am, we are really thankful that you dedicated this time for us during your busy schedule. Really thankful, ma'am. Ma'am,
Thank you.
now on to Shweta, ma'am. Pinati, ma'am.
Yeah, and it was really a good experience. Like I didn't ask any questions as of such, but listening to them, getting answers to all the questions, it was really nice. And the
Thank
way
you.
like you put in the importance of empathy, this is something like more or less, I guess once in a while, every one of us gets a question like, are we doing enough for our profession,
Right.
or are we doing what we can? So it really inspired us, and it helped us in some way to go forward. Whenever we may hit a block in future, I guess I would remember your words some way or the other way when I am facing a tough time. So thank you very much, ma'am, for giving us your time and answering our questions. Ma'am, can I take one screenshot, like just for memory?
Sure, sure.
Thank you, ma'am.
Thank you.
Okay.
Bye.
Thank you, ma'am. Bye-bye, ma'am.
Bye.